Hello, I'm Dr. Nora Schiffers. I'm from Germany in the very north, from Bremen. And today we are going to inject our nice patient, Eva. She's 60 years old and she has never ever done fillers, but she has some threads over here. And today we have planned to do something for her temples over here. So because during the ages we start to hollow and to give her a nice shape so that it's not so concave, we are going to fill it a little bit. And even we have planned to do something for the highlighting right here. Yeah, women always use it with makeup, so they just use a little bit of highlighter so that they have a nice light reflecting point. And today we are going to inject it so that it just occurs even when she's just looking fresh. So, and we are also using this nice tool. It's called a caliper, this one. And therefore, we start to measure it at her eyes, because the eyes is the only part in the face that never changes the distance between aging. So we are going to start like this. We have done it before, and there we find the highlight point. So it's something to do with the golden ratio. Yeah, but it would take too long to go into very detail this time. And because you can check with the golden ratio the width of her nose, we see that it's a little bit too wide, so we are going to add a little bit volume to the piriformis fossa to narrow the nose a little bit, so it seems to be a little bit smaller, like this. Okay, and for the products, we are going to use the RENÉE. It's a very cool product. It also contains amino acids, proline and glycine. So we are also stimulating the collagen production. And it's very unique because it integrates very good into the tissue. It's nearly fluing and integrating like it's a body-owned product. So you don't feel it as a patient. This is one very good advantage. And you could also inject a higher amount of the product and just massage, and you don't have any granuloma or nodules or any lumps. So we are going to use it for the temples and also for the highlight point and for the piriformis fossa. Okay, we are going to start with the highlight point. I'm just injecting right on the bone, so we are in a quite safe zone. So here I inject an amount of 0.2 with one injection. I inject quite slow so the patient doesn't feel discomfortable or feels any pressure, and therefore it's very nice for the patient.
Dear Nora, this is the one question from the auditorium. What is the size of the needle do you use? Is it 25?
It's a 25 gauge needle. It's in the package of the volume because it is a stiffer product.
Does it contain lidocaine?
No, unfortunately not. But as you can see, Eva, it doesn't make any pain. Is it painful for you? So no, it's okay. What you have seen, by the way, during we were talking, we made a little lifting. So I was injecting a 0.2 in the first incision, and after that, I was withdraw the needle a little and moved a little further to the top and did a lifting, and just went again to the bone and inject now 0.1 for the second time. As you can see. To give her a little bit more, over here we are going to make a second one. And I always aspirate when I'm using the needle to be sure that I'm not in a vein or any vessel.
We don't want to interrupt you. Do you prefer questions now, or probably then you finish everything?
You can ask by now.
When you do aspiration test, do you suppose the needle should be empty or filled with the product?
Yeah, you can move on.
Because when we do it first time, then it can be empty. But for every next injection, needles can be filled, or will be already filled. So my question is, how do you suggest? There is no any rule for the moment, but what do you suggest? To change needle or not?
Changing needle is a good thing, but it also works when you're not changing it. You can also aspirate, and if you're in the vein, there could be also a positive aspiration if you're really in the vein. So I would suggest aspirating every time, never use needle without aspiration.
We clearly see lifting, yes.
Yeah.
Thank you, thank you. Yes, I thank the operator for the zoom out. Yes, we do see everything.
Yeah, so if you compare the sides, you see, and you don't feel a big nodule or anything over here, even if we have already injected 0.4.
And in one syringe, how many you have?
1 ml.
1 ml. Mm-hmm.
Okay, so moving on to the piriformis fossa.
Could you please comment how deep you are?
I'm right on the bone because over there it's dangerous if you are too high. You have to be right on the bone or subdermally. Subcutaneously could be dangerous that you are in a vein or in the arteria. So this is not a really nice region to get injected, but even over here, ether is very relaxed, as you can see. So I have already injected a bolus of 0.1. Everything all right, Eva? Mm-hmm. Perfect. Everything all right in the audience?
We see everything, every tiny millimeter of the plunger, of the movement of the plunger. And what is going to be maximum amount of the filler here?
I'm going to inject 0.2 over here to lift it a little bit, and also because she has a quite deep depression in the nasolabial fold. Mm-hmm. So to smooth it a little bit.
For this case, it's going to be 0.2, but globally, what is the maximum amount that you can suggest to work with?
I never inject more than 0.3 in one time over there, but with the RENÉE, the quite cool thing is that you don't have your nodules or lumps or foreign body reactions because it completely integrates into the tissue and it's very smooth. So you could also maybe use a little bit more. So, but as you can see, it's softened over here. There it's a little bit lifted and softened. So because we haven't left so much time, we are going to use something for the temples. I have already marked the point because I prefer needle over here. Yeah, you can feel the temporal crest here, and then you go 1 centimeter up from the orbital rim and 1 centimeter below. And if you insert right on the bone, it's a safe place. So, and here it is important that you put pressure on the hair, so that because of the anatomy, the temporalis muscle sticks right onto the bone, so that you don't lift the hair. It's important that you put a little pressure on the hair.
What kind of sensation your patient can have during post-treatment period?
In the temporalis region, they can feel a little.
This technique.
Yeah, they can feel a little pressure. In most cases, this will be gone after about 30 minutes. It's getting away. So after 1 hour, they feel nothing. And if they touch this area with a lot of pressure, it can hurt for a few days, but after that, it's gone.
Have you ever seen in your practice or heard from others any kind of uncomfortable sensation in this place during mastication? So when
No.
patient eats something and then they just feel uncomfortable?
No.
Okay.
No, because you have so many other chewing muscles, and they don't feel doesn't hurt so much. But I would recommend not injecting more than 0.5 per session. Even if the patient needs more, the pressure is nicer if you do it in more sessions than in one if you have to inject more than 0.5.
And touch up, in case this patient, not this, but any kind of patient needs touch up, then you suggest to do that. In how many days, weeks?
I would do another session after 2 weeks. I would like to see them again, and after 2 weeks, I think you could also do a retouch for the temporal region. So then it's okay, but I would wait at least 2 weeks.
Even with 0.5, we see clearly result.
Yeah.
So you never inject more than 0.5?
Not in one session. Yeah, but it's more because of the pressure the patient feels over here than because of the product. So the product you could inject even more, but it spreads a little in the temporalis region, and if you inject more than 0.5, it's a little bit more discomfortable for the patient, and it takes quite longer for them to recover again. And so it's nicer for them just to inject it in more sessions and a little less amount. So you can see, now we have done quite a good lifting. The temporal region, it is not so hollowed like on this side. So maybe you turn a little. So it's a little bit more hollowed over here than here, it's smaller. So she looks a little bit lifted. As you can see, even in the mouth corner, here she has more folds, and and here she's a little bit highlighted. The OG curve looks nice. You could do additionally something for her mouth corner right over here, so that you can lift it a little bit. And we could later on also restore here her gonal angle so that it is more sharpened and the line is more precise, so that we could do something for her jawline so that's more defined. So we're going to do the other side, so that she's not going with half side. So if you are ejecting a lot on the bone, the needle often gets a little bit unsharp, so we have to change it a little bit more often.
For this area, you always use 25. You never go for wider conductor, like 23 gauge needle, for instance.
You could also use a 23 gauge needle in this area. That would be no problem. You could also use it. The 25 gauge is in the package, so we used it today, but you could also use any other needle which is a little bigger. No problem. And now a lot of people also prefer cannula in this area. We have seen it before, But I, by myself, like needle a little bit more. You have just this one insection, and I think it has a good lifting effect over here.
Do you do this slow injection on purpose, or it's just the filler is too hard?
No, I do it on purpose. For the temple region, they don't have so much pressure. So it's just very slow, and then the pressure you start to get over there is not so high. So it's more comfortable for the patient.
And what about aspiration test in this area?
We have done.
Always.
Always. I aspirate everywhere where I inject. When I'm using needle, there is no way not to do it for me. So it's almost finished. Any more questions?
We just let you finalize the treatment, and the rest is just characteristics of the filler. I mean, percentage or how many milligrams per milliliter of hyaluronic acid, and what is the cross-link agent?
It's 28 milligram per milliliter ml. It's the stiffest product of the RENÉE we are using. But even if you just try to feel it, you don't feel any nodules or granulomas, or you don't really feel the product in the tissue. So this is very nice about it. So now we are going to do the highlight point over here.
So here, if I can add something, I am project manager at Cuventis, the producer of RENÉE. So what is special about this cross-linker is that not only, obviously, it's cross-linked hyaluronic acid standard with BDD, but we have an innovative technology that allows us to have a true monophasic hydrogel. This means that in comparison to other competitors, we have a completely homogeneous and elastic and cohesive hydrogel. And for this reason, as you can see, the results are more nicer, are more natural.
Thank you very much. And there is a question from auditorium. What's the level of injection? So please repeat once again for the zygomatic area and for temporalis area, where you are exactly. We see it, but we would like your confirmation about it.
Okay, for the temporal area, we have injected 0.5 per site. And for the zygomatic area, we have injected 0.3 per site. So, and then we have put 0.2 in the area of the piriformis fossa.
And you are on supraperiost, right?
Yeah.
Supraperiosteum in both cases.
In both cases.
And a little bit probably intramuscular in temporalis fossa, because there you have a muscle right away.
Yeah. Just like this.
You already said about the quantity of hyaluronic acid. And cross-link, you said this is a BDD.
Yes, it's
Can
BDD.
you share with us the secret of percentage of BDD, how it's compared with other fillers of the market? More or less the same?
So the percentage of cross-linking is around 5%. Okay. So we have slightly higher concentration than other competitors. So for example, RENÉE volume is 28 milliliters, but concentration is just one aspect, one parameter that obviously characterizes the hydrogel. So even if the concentration is a bit higher, considering the manufacturing technology that we use, we are able to still have a product that is very easy to inject, and that it doesn't feel hard on the skin. It feels really soft and natural.
Is it hydrophilic, highly hydrophilic product or not?
So you can expect from the higher concentration, higher swelling, but in reality, this is not the case. So again, for the special manufacturing technology that we are using, the swelling is really, really limited. So what you see after injection is what the patient is not getting swollen after time.
Thank you. And why you decided not to put lidocaine?
So the question of using or not using lidocaine was obviously considered. The point is that normally the most painful moment is the injection itself, when you go to puncture the skin. And obviously in that moment, you are not having lidocaine in any case. So having lidocaine inside the hydrogel, it's more a psychological effect for the patient in reality.
I'm not a producer on lidocaine, so I don't say that all fillers have to contain lidocaine. I just would like to support your discussion and explain that really when we inject on the bone, I would like to ask our excellent presenter if she agreed with me or not. We don't need lidocaine. The injection on the bone, they are painless, so we don't really need it.
Yeah. For sure. If you're right on the bone, it's not so painful. The insertion is the most painful. And afterwards, when you're right on the bone, you don't feel so much. It's just like the way you said.
And this kind of speed, I'm sure that we saw the mimic reaction of the face of the patient. She didn't feel anything. So you could even not ask her. We saw that it was absolutely comfortable for her. Thank you.
Yeah, thank you.
Our dear participants, if you have any question for, yes, we have one. Where is the insertion point on the temple? Could you please once again to repeat how you choose your point of insertion?
For sure. I've just removed it. You can feel the temple crest right over here, and I will always mark it. And for the injection point, I go 1 centimeter up on this crest from the orbital rim and 1 centimeter below, and there was the injection point. And just then right on the bone. So when you feel the bone, you are
And I think if we see visible subcutaneous veins, we just should avoid it, right?
Yeah, you just go a little bit to the right or the left so that you don't see them. And then you have to tell patients when the veins are very good, you can see them very good, that maybe you will see them a few days a little bit more, but afterwards they disappear like before.
Thank you very much.
You're
It
welcome.
was amazing presentation. And as I see the time of our excellent discussion has finished, thank you, Nora.
Thank you too.
Thank you.